Hey, welcome back everybody to another episode of In the Community with Dr. Matt. And we're actually hanging out with a very special guest today. We got Isabel from Midwifery Care here in Halton, Peel.
Yes.
Did I say it right?
Midwifery Care, we've changed our name a little. So it's Midwifery Care, Midwives of Brampton and Halton Hills.
Beautiful.
Yes.
Awesome. So Midwives of Brampton and Halton Hills. And this was a really exciting episode because I've had my wife Sarah, more so than me, 1, 2, and going on 3 experiences here. And the very first one was with Isabel.
Yes.
Yeah. And I think back to all those years ago and what a pleasure it was. And what a warm, welcoming experience it always was.
Yeah,
right?
I'm glad.
Yeah, I was always excited to be a part of it too when I could. And I thought we'd, get excited to share that message with you guys today and talk about a few things that, gets you excited and go from there.
Sounds good.
And handle some common misconceptions of midwifery care altogether so that potential moms out there can know a little bit more and get the care.
Yes.
Yeah, they deserve.
That I agree.
So do you want to tell us how you got started?
Sure. So like a lot of midwives, I had a career first. I went to university for something unrelated, and just in the course of finishing that degree and getting out and working, I just felt unfulfilled. I knew midwifery was out there. I had an aunt who'd had a few home births at that time. And so in just trying to figure out what I wanted to do with my life, I researched midwifery and just everything I could read about it just resonated with me. I think the most, the part about it that stuck out and excited me the most was how much interaction, how much help we can be for women. So I think with regular doctor care, and it's just the way our system is set up, there just isn't the time and the attention that can be put
The system's
with
not
each
set
woman.
up ideally
Yes.
for
a lot of
pregnancy and
attention,
birthing.
right? Not
Yeah.
a lot of attention
Yeah.
per client, right?
Yeah.
Or per patient.
I think that's a good way to put it.
Yeah.
Yeah.
And pregnancy can be seen as sort of an ailment or an illness, and
Yeah.
midwives look at pregnancy and labor and delivery from the other side, where pregnancy
process of health.
exactly is natural. When you're low risk and normal, the expectation is that the pregnancy and labor and delivery continue to be low risk and normal. And so when you come at pregnancy and labor from that perspective, the rest of it just can be a much more relaxed, a much more warm experience, I think, for women. We take on much fewer clients than doctors, so general physicians or obstetricians, so that we have more time to spend with each woman, with each family, to be able to discuss what it is that they're feeling, questions that they have, also the next steps coming up in the pregnancy, what they can expect, all of the regular tests and procedures.
It demystifies a lot of things.
Yeah, exactly. Yeah. We can actually talk about all of the regular tests and procedures that are offered in pregnancy. Everything is still offered with us than you would have with a doctor, but we just have more time to go over what they all are, why we test for them, how it may or may not be important to that woman, so that she can make the decisions for herself about whether or not those tests and procedures
are valuable.
Exactly, and are things that she wants to do.
Excuse me.
I think sometimes people go into their pregnancies just expecting to be kind of shuttled along the process, and they don't really know what the tests are that they're doing, or what they're looking for, or why they might be important, and it just feels like you're on that kind of conveyor belt. So we don't subscribe to that.
I love that.
Right, we require that the family makes the decision for themselves.
I think that's amazing.
Yeah.
Yeah. And I know that's one thing that gets me excited, especially, when I do make it here with Sarah for an appointment. It's always, A+ level of, interacting with the patient. Right? So what's the common misconceptions that people have?
Right. I think there's quite a few. I think firstly that, well, I guess exactly what midwives do, that we actually are a clinical care provider. So we're not just there as a support person, but we do all of the clinical management of the pregnancy, the labor and delivery, the postpartum, as long as everything continues low risk and normal. But as long as those things, as long as all is normal, the person does not have to see a doctor for the entire pregnancy or in labor, and it's just the family and the midwives through the whole process. So we can take care of everything that is medical, through all of that. Also, that we are not that we're not something you have to pay for. So OHIP does cover our
It's all looked
fees.
after in your taxes, basically.
That's right.
Yeah.
That's right. So it's not something that people have to seek out and pay for on top of anything else, right?
Which I think is really important, because that could be a misconception that people have to coming in. They're
Right.
not sure if they, what the first visit is. I mean, it's important for you to know out there it's technically complimentary to you.
That's
right,
right.
if you're looking for
yeah, in fact, people that don't have OHIP coverage
Yeah.
are still entitled to midwifery care, still free of charge. So
Wow.
yeah, so people that are newcomers to Canada or don't have OHIP for whatever reason, they would usually, if they're seeing a doctor, they're paying every time they see the doctor, right? Like there's a fee per visit, but we're part of a little umbrella of funding that doesn't happen. So the government still pays
Beautiful.
us for the non-OHIP clients.
Which is impressive.
Yeah. So
Yeah.
it's a really
I'm
big
just going to
help.
reach across you here.
Sure.
Okay, I'm going to grab a Kleenex. I forgot that it was like 8,000 degrees
It's
in here.
really warm in this office, sorry. Yeah.
So here's one of the things that you got to know when you come here, is that it's
Right.
usually set up for new babies coming in, right?
That's
Yeah.
right.
Yeah.
It's comfortable
So-
for them.
Yeah, what do you guys actually keep that in here?
Oh, I don't know. Warm.
Warm, perfect.
Warm.
So what is, to the new mom, really you got to go through the interview process, right? Because
Right.
when we called up, it's always, hey, yeah, we've had you before, right? So more or less come on in,
Right.
right? But still there's an application check.
There is, just to screen that a woman or a family would be appropriate for care, and someone who wouldn't be appropriate would be somebody who has underlying health conditions that may
Right.
make then the pregnancy abnormal from the get-go.
Yeah.
So it would be hard to say what those are, but things like, if somebody's already diabetic, for example, we wouldn't be able to take care of them in pregnancy.
Yeah.
But things like that, a pretty serious heart condition, things like that. So it's best to call, and then we can
Always
talk
call
about
and ask the
Better
question,
to
which
call.
I think is a big thing for, even
Yeah.
in my profession, is that, hey, it's better to go interview a couple people first, see
Right.
who's a good fit. And I think the same applies for you guys, is
Right.
call up and ask the question if it's the right place for you.
Right. The
Mhm.
other, another misconception might also be that you don't need to call a midwife until you're well into the pregnancy, so
Okay.
into like 12 weeks or so. But that's not correct, because we do fill up quickly.
Yeah.
So it's best to call or get on the website. You do an intake. Usually for most clinics it's online, but you do that really the moment you know you're pregnant.
I know, I always joke with moms in the office, it's like, or before you're even a mom, like, hey, you better get on that phone.
Yeah,
if
get
you're
on the list.
thinking of it. Yeah, call ahead if you've been thinking about it, or if you're trying, call ahead.
Call ahead.
Right.
Well, yeah, the moment you have like a positive pregnancy test, it would be appropriate to
Okay.
get an intake into the midwifery clinic, because the spots, we don't have that many spots. We wish we could have more.
Yeah.
But they fill up quickly. So
And I think, some of the things to mention that, that you really view the body very similar to a family chiropractor would, and that health is a normal process,
right.
right? And that pregnancy is a normal process.
That's
Because I can remember family members joking around saying you're pretty brazen having your babies at home, right? And I mean, realistically, do you know the stats, or can you comment to it at all? Because I mean,
About
you obviously
home
do it, yeah. To people who are wondering out there,
Sure. So home birth is not as common, I guess, as we
in an
wish.
industrialized society.
Right,
Yeah.
right. So I think, another misconception is that if you have a midwife, that means you're planning a home birth. That means that you're saying no to the hospital, and that's not true. So all midwives have privileges in hospitals, because really a majority of our deliveries do happen in hospital. But in our community, about maybe 30% of our clients do deliver at home, or plan to deliver at home. And there's been lots of studies around the world, but certainly in our communities in Ontario, that do show that home births are as safe as hospital deliveries, and can lead to lower rates of perineal laceration, so that's tearing after delivery, lower rates of interventions,
Altogether.
of instrumental deliveries. So it's actually leads to slightly better outcomes for moms and babies.
Which I think is incredible and a huge testament to what you guys do.
That's right. And it makes sense when you're at home, if you're feeling like that's a comfortable place to be, that you're going to feel more comfortable. You're going to labor better. You're in your own environment. So if there's no reason that you have to be at the hospital, home is a great place, for people to be.
Which I know with our first daughter, we worked pretty hard to have her home.
Yes.
And then we ended up at the hospital for the last 2 centimeters.
Right.
And then with our second daughter, I mean, everything just,
Yes, yeah.
And I think it was more or less, I mean, Sarah's the best one to ask about this, but I think it was more or less she knew more of what to expect.
Right.
That was my impression.
Right.
Is that what you'd comment to first versus second?
I think so. I mean, it's hard to say. First time moms being at home, just labors can be longer.
Yeah.
And in that length of time, I mean, you're laboring, you can become anxious about why it might be taking longer. Coping is harder, but so it is hard to stay home with the first baby, but it's certainly possible.
Yeah.
Second babies tend to come a lot quicker, so
your body knows what to do.
Yeah, and there's maybe less time to worry, and things are less complicated, I suppose. But yeah, even first time moms, I mean, they can stay home, and we have lots of successful first time births at home. So it's always nice to plan, or at least to stay home as long as possible if people are trying to avoid an epidural. Another misconception, I mean, you can have an epidural if that's your plan, which is fine and acceptable. With a midwife, right? So midwives certainly don't administer epidurals. They are something that anesthesiologists do at the hospital only. But having a midwife doesn't mean that you don't have access to those things. You can have an epidural, you can be in the hospital. If you need other medications like oxytocin to keep a labor going, that is still accessible to you. None of those, having a midwife doesn't mean that you aren't allowed to have those things.
Which I think that's also really important for people to know.
Right.
Yeah. Because the interaction is so much, so different. I mean, I can only comment to the midwifery experience, but from what I hear from other people, though, as patients in the office and whatnot, the interaction is always, I want to say warmer.
Yeah.
Right? It's still warm in the other places, but I think that you get and I mean, evidently physically here too, right? It's warmer.
It's warmer.
But I think on the same token, it's just, it's totally a different level of care. In an industrialized society, I think it's overlooked.
Yeah.
And I think people are in such a rush with their technology and their screens that they, realistically, we come in here for 40 minutes to an hour sometimes.
Right.
And sit down and chat and go through.
We have the time.
Yeah.
We also, it's important to us that we make those connections, right? So that continuity of care is a big piece of the midwifery care. So when you have doctor care, you are usually seeing one it depends on the kind of clinic that you're in, but who is there at delivery, you may not know who, right? So maybe a doctor you've never met before, you are being attended by the nurses that are on staff who the likelihood is you've never met before either. And for some women that's fine, right? But research has also shown that having a known care provider can lead to better outcomes for a mom, can lead to less need for epidurals, right? Higher satisfaction for moms and families. So it is part of how we set up care that you're only going to meet a small group of midwives, and that the likelihood is that it is one of us on call at the time that that you're delivering. And so when you go into the hospital, it is one of the midwives you'd met before that meets you, that attends you through the entire labor, through the delivery, right? So you're with somebody, a familiar face, and that can make a big difference for moms and families.
All these little nuances that get overlooked, for 70 to 100 years, right?
Right.
That essentially have come full circle since the late 80s. It was officially
so the late 80s was when there was a real big movement to have modern midwifery back in the system, and by 1991, I believe, is when we became regulated. It became part of OHIP. We created an education system, so our university program. So we owe it to, and we have some of those pioneer midwives in this clinic as well. So we're really lucky. We owe so much to them and the fight that they took on. But
it's impressive.
Yeah.
I can relate to that.
Yes, exactly. And so, I mean, before that, women always sought out midwives because there was always an undercurrent, sort of a subculture for home births, for people that didn't want to be in the hospital, that always believed that pregnancy and birth were normal and natural, and how do I continue to keep it natural going, and how can I stay home? So there were always midwives around, but they weren't as organized. They didn't have the education system, right? They had their education from where they could get it, and it was something you pay for. There were fees. So by the early 90s, we were able to become regulated. Exactly. And so for that, I mean, it's a safe option, right? And a free option for women.
which I think is amazing. I think, one of the things that, when people make comments about, coming to the midwife or having a home birth, what did they do 2,000 years ago before there was organized medicine, is my question back, right? It's like people have been having babies for thousands of years and somehow they've, managed to come out.
Right, exactly. The other thing is, we are still evidence-based practitioners, right? So it's not that we snub our noses at medicine. We know the guidelines, we know the research that's there, and we are evidence-based, so we practice to those newest guidelines, right? So it's not that we say no to medicine, it's just we like to use medical intervention sparingly.
When it's necessary.
Yeah.
When it's absolutely necessary.
Exactly.
Yeah, and I think that's one thing I like to drive home in our practice as well, is for the right reasons.
Right.
Yeah.
Exactly.
I think that's perfect. And evidence-based, I think, it means a lot of things, but also means taking you, the viewer, the patient, taking your perspectives into account, not just the hardcore randomized control trial.
That's
that looks at all.
Exactly. No two pregnancies are alike. Doesn't matter it's for the same person or a twin sister. So for every pregnancy, for every labor and delivery, there's always going to be a subtle change, a subtle difference that, you can't apply one cookie cutter
to every single person.
Yeah, to every single person, pregnancy, labor. So people have to make those decisions. We have to make those decisions. So based on evidence, based on a woman's health history, based on what's going on in that exact moment, and things can always change, but we have that basis of knowledge. We have the evidence that we were trying to draw on to make our best decisions.
Awesome. Is there anything else you want to share with anyone watching?
No, I think just, if you're a healthy pregnant person, you should try to get into midwifery, or try to get a midwife to help with your pregnancy, to take care of you in pregnancy. It wouldn't be a decision you regret. I
fully agree. And I hope that this interview brings some light to people watching.
I hope so.
And if you want to connect with Isabel, how do we do it?
Well, if you are pregnant, you would want to get onto the website here. So just, I guess, Google up Midwives of Brampton and Halton Hills. And if you're not in Georgetown or Brampton, then the Midwifery, the midwife clinic that's nearest you, you can go on the Association of Ontario Midwives website, and then that will show you a map of all of the clinics out there.
Beautiful. Yeah,
and then find the midwife closest to you.
Yeah, well, I can't say enough good things. So I really love having you guys around. Yeah. I know Sarah appreciates it, and so do the kids.
We appreciate you guys.
Yeah. So thanks for doing
what you do. People
that keep
coming back.
Yeah, that says it all, I think. Keep coming back.
That's right.
Otherwise, we'll see you soon, and have yourselves a great day. If you have any questions, you can put them below in the comments or direct message as well. Bye for now, guys.
Bye. Thank you.